Before I even decided to become a dentist, I had no idea I wanted to be a dentist. In undergrad, my best friend was taking the test to be a dentist, and I didn't know what I was going to do with my life, so I told her I would take it with her. And I am scoring like top 1%, and then that's kind of what sealed my fate to become a dentist. So right now we're just setting up the computer. This is our x-ray unit. This is where we could take your 3D x-rays so we can really see what's going on. And then we also take what's called a Ceph x-ray just to kind of evaluate what's going on with his bite and his jaws. After dental school, I worked in private practice as a dentist, and then I also did another residency. And that's when I realized I really wanted to be good at one thing. And that was when I decided to become an orthodontist. It's not just straightening teeth. A lot of it is like fixing bites, fixing jaws, fixing faces. And I love what I do. Open up for me, bite down. After we do our evaluation, I'll sit the patient up, and then we kind of go over the photos. It's just a nice way of laying it out so you can really see how your teeth look. So we go over what's going on, what we can kind of do for you, and then we could either put the braces on or do a 3D scan to start clear aligners. It's from the most simple case to the hardest case. Every case I get excited about because you're making big changes for people. There's like a specific way you're supposed to have the bracket. Every tooth has a very, very specific prescription. You can think of like a shoe size. So there are different directions, left and right. Each have a specific name. You want to make sure you put the right bracket on that one tooth. Where you put it on the tooth matters a lot. That's how we move the teeth. If you have it in the wrong spot, it'll move the tooth in the wrong direction. So my job is to put it in the right spot, right tooth, and everything else will fall in line.
I'm gonna start leaning you back now. And if you could open for me, please. Did you like the blue color last time? Mm-hmm. So right now I'm just taking off the old colored bands. And I'm going to take off the wire as well, and then Dr. Dow will come in and evaluate everything for you, okay?
This is all I do. At this point, I've probably seen, I want to say at least like 10,000 patients. So I've seen kind of everything and anything under the sun. Open up real quick, bite down. Nice. We're going to go 1925 night high on top and bottom. Power chain upper lower 6 to 6. So it's a full power chain. And then next appointment will be 60 minutes. It's called pan repo. So for us, we see you guys every 6 to 8 weeks. We'll kind of check your braces or your clear aligners, making sure everything's working well. We're just gonna switch your wires today and then put something different. It's called a power chain. You have like little tiny spaces, it'll close all those tiny spaces up. Oh yeah?
Thank you.
You're welcome. Every time you come in, we're switching wires. When you first start with treatment, we start with a pretty light wire. That way the wire fits and it causes minimal discomfort.
These are just the night tie wires that we use. There's a difference between the uppers and lowers. The uppers have these 3 dots in the middle so you can tell. And then today we're doing 1925. Okay. And now we'll go ask if the patient likes the color.
I had one patient the other day. Literally her only complaint was like, this one tooth is off just a little bit. We were able to fix it in a few months, and she's happy as ever can be. She started crying in the chair. Like, she was so happy. Like, just little changes can make big differences.
Today, I have a bunch of colors for you, and you can choose. That purple one? Okay, perfect. And I like to pre-cut my wires, so I line it up with the old ones. Right now, I'm just putting in the new wire. And you want to line the middle dot to the center of the face. Okay. Now I'm just adding the power chain. Everybody does it a little differently. This is how I do it. You're gonna turn your head towards me this way? Perfect.
So far we've seen probably about 15. And we started at 8, it's 10:30 now. When you straighten somebody else's teeth out, you remember the after effect. Keep it up. Everybody looks great. It's a good feeling when you can change somebody's life just by changing their smile.